Hello and welcome back to my YouTube channel, Doctor with PD. My name is Andrew Dean and I'm a consultant doctor. I'm 37 and I've been living with Parkinson's disease for a year and a half. And this channel is for those who have been diagnosed with Parkinson's disease or people who've been affected with Parkinson's disease with their family or friends and want to find out a little bit more. I'm hoping I'm offering a unique perspective as a doctor and a patient. So this video is primarily for people who've just been diagnosed with young-onset Parkinson's disease and have questions like, what is Parkinson's disease, how common is it in the young, what am I supposed to expect, and what sort of treatments should I have. So before I start, I wanted to say, if you've just been diagnosed with Parkinson's disease and you're less than 50, and I understand there's a lot of things going on. It's a scary time, you don't know, you're asking lots of questions. Don't just relax. Give yourself time. You need time to accept and understand what you've been diagnosed with. And I hope this video helps. But your life is not over. If that's what you're thinking, it's not over. It's just changed. I thought my life was over for a couple of days until I've had a bit more time to read through what it means. So if that's you, just relax. I hope you find this video helpful. Comment below if you have any questions specifically. So first of all, I thought it would be helpful to map out question 1. What is Parkinson's disease? Well, it is an incurable progressive disease of the brain where the brain cells that produce dopamine are dying off, particularly in the area called the substantia nigra. But the main function of dopamine is controlling movement and coordination, but there are other things that it does, and that is why the symptoms of Parkinson's can be quite wide-ranging depending on how the brain has been affected. The exact cause is unknown, which is often why it's called idiopathic Parkinson's disease, because we don't know the exact cause. We think that it's a combination of genetic factors and environmental factors. So if you're particularly young, in your teens and 20s, you will go for genetic testing to see if there's anything in the family, in the genetics, that might predispose to Parkinson's disease. But if you're like me, you may be tested for genetic mutations but come back negative, and it doesn't mean you haven't got one, it just means we don't know what it is yet. So it's a combination of genetic factors and environmental factors. I don't think anybody really has any good answers to why people get it. So it's not that you've done something wrong. It could be something that we've ingested pesticides, it could be lots of different things, but we just don't know. But it is a combination of genetics and environment factors. Second question is, what is young-onset Parkinson's disease? Well, Parkinson's disease is typically affecting people over the age of 60. Young-onset Parkinson's disease is those who are diagnosed less than 50. And it's a different disease to the standard Parkinson's disease that I come across as a doctor. It can progress a lot more slowly, which I think is probably why it can take years to diagnose, because the initial symptoms may be quite subtle. It may present with fatigue and depression and constipation, things that GPs would say, oh, maybe you're just depressed, take some antidepressants. And then later on, you have more movement problems, and in retrospect, you've had Parkinson's disease all along. So don't be too harsh on the GPs, because it's not easy for the GPs to think someone in their 20s and 30s might have Parkinson's disease, because more common than not, we don't. But there are people like us who do have Parkinson's disease in the young. In terms of how common is it for young-onset Parkinson's disease, a survey for the UK had about just under 150,000 people with Parkinson's disease of any age group, and it's split down into sort of decades, and those under the age of 50, there's just under 2,000 of us. So it's a small percentage of the population of Parkinson's disease, and in the grand scheme of things, of 66 million people in the UK, just under 2,000 does mean that we are still quite rare, but it's more common than I thought. Young-onset Parkinson's disease also has different presentations that may not be typical of other people with Parkinson's disease. So we are more likely to have things like dystonias, which are the abnormal cramping posturing that may result in severe pain. My main symptom when I was diagnosed with was foot pain, like a plantar fasciitis, really, really cramping, painful. Couldn't sleep with it, sort of pain. We are also more likely to have things like depression, and we are also more likely to get dyskinesias. which dyskinesia means abnormal movements or uncontrolled movements, and as we go on with Parkinson's disease, those will come in, I suspect. Thankfully I haven't got many of those yet, but I do get some abnormal posturing and abnormal movements. We are less likely to get dementia. That was a big problem that I had when I first diagnosed. I was convincing myself that I'd have dementia in my 40s. That is not true, and that was one of the first questions I asked my consultant when I first met them. So if that's you, relax. That's not going to be your main problem at the moment. So be encouraged. Our prognosis is a lot better than you think. Your life is not over, it's just different. So what symptoms do people with Parkinson's disease get? Well, slowness, stiffness, rigidity, tremor, constipation, bladder problems like urgency, frequency, fatigue, pain. There's so many different things that we get, but not everything that we get is related to Parkinson's. You may have problems with dizziness on standing up or postural symptoms. That is also part of Parkinson's disease. It's sort of postural instability where our blood pressures can drop because of the Parkinson's disease that we have. That I think we'll have to address in another video. So I want to move on to treatments for Parkinson's disease, and this is not just including medications, but it will include medications. If you go back to what is Parkinson's disease, it is the nerve cells that produce dopamine dying off, and dopamine is important for movement control, and so that will be resulting in your tremor, your stiffness, your rigidity. So the main part of treating Parkinson's disease is replacing what we've lost. So there are L-DOPA medications which replace the dopamine in the brain. There are medications that stop the breakdown of dopamine, thus bringing up natural levels of dopamine. And then there are dopamine mimics. They'll be called dopamine agonists. So the medications that I think are helpful to be aware of are those three main types. There are other ones that sort of supplement Parkinson's disease treatments. The L-DOPA tablets are helpful, and if you're scared about starting to take L-DOPA early on, please don't be. There's a lot of fear-mongering that says if you start L-DOPA early on, you're going to suffer side effects later on. There's no evidence that is actually true. This comes from the idea that when they first started using L-DOPA, they used quite high doses straight away to get good responses, and then they got the abnormal movements. But if you sort of slowly introduce the L-DOPA and you go in slow increments and you go according to your symptoms, you'll actually do relatively well. So I'm on Cinemet 1 to 5, 4 times a day, and I'm doing fairly well on that for the last year now. Those are called Cinemet or Madapar. It's a combination of an enzyme and dopamine to make sure that the brain gets the dopamine that it needs, and you will need to take that 2, 3 or 4 times a day to get the even control of the dopamine. Dopamine agonists are copying dopamine, and these tend to be ones where you can take a tablet once a day and give you a sustained release of dopamine agonist or dopamine mimic. There's some suggestion that this means you don't have to take the L-DOPA, and a lot of people do very well on just 1 tablet a day. There are side effects that you should be aware of, and you need to talk to a neurologist about if they're talking about starting you on a dopamine agonist. But again, everybody is different, so if you're on a dopamine agonist, you're doing well on it, very good. I stayed away from it myself because I was concerned about the side effects of dopamine agonists, such as compulsive behaviours, hallucinations, psychosis, but ultimately it's for you and your GP and you and your neurologist or movement disorder specialist to really come to decide what you're going to be on. Then there are medications that reduce the breakdown of dopamine. These would be the COMT inhibitors or the monoamine oxidase inhibitors. I'm on rasagiline, and I think that's helped me quite a lot, but this is not going to be a monotherapy for very long. I suspect if you start on one of those, you probably will end up on L-DOPA eventually. So those are the main medications that we use, but there are also other ones that we would use, and that can be in other videos. But a big supplement to medications is exercise, and that's what I really want to sort of focus on on another video. But exercise is a really big part of Parkinson's treatment, and it has been shown to slow the progression of Parkinson's disease in some studies. As well as doing that, it also just makes you feel better. I find that exercise is a good way of controlling my symptoms, and if I don't exercise, I do feel it later on. There are some people who actually manage their Parkinson's solely with exercise. Sort of rowing or cycling twice a day for 30 minutes each time can control their symptoms rather well. And it also helps you with a positive mental attitude as well. There's a Parkinson's lifestyle treatment called the 4 Pillars of Parkinson's, which involves medications, which I've talked about, movements, exercise, but then lifestyle and psychology. Lifestyle means things like you choose how you respond to things. So taking control of your life and choosing things that will improve your life is a big part of it. So it links quite well with the psychology, where you have to sort of accept, comprehend, motivate, and then leads to action. So that is a whistle-stop tour of a lot of different things, and I will be picking up on different things later on in other videos. But I thought it'd be helpful just to map out what is Parkinson's disease, what is it, how common is it for young-onset Parkinson's disease, and what are the broadly speaking, what are the main treatments for early-onset Parkinson's. There will be other things that we can talk about in other videos, but I thought this would be a good starting point. So I hope this has been helpful. Please do like, comment, ask questions in below, and I will put some links in the descriptions to the surveys and other useful websites like the Parkinson's UK website. And I'd also encourage you, if you use social media, there's a great Facebook page for people with Parkinson's disease in the UK. I'm a member. There's lots of people there who are really helpful. So you are not on your own. You do reach out for support, because it is underestimated just how important, massively important it is to get support from people. I had a massive support from family, friends, work colleagues and church who were just so very helpful. And so if you're on your own, please reach out. There are people out there who will support you in the local area or virtually via the internet, and please ask me any questions. So I'm Andrew Dean. I hope you found the video helpful.